All right, everyone. I think we are going to get started. It's 1 o'clock here in Portland. Good afternoon, everyone. My name is Jonathan Mans, and I'm the director of the first year experience here at Lewis and Clark. And we're thrilled to have you join us for our second of 8 weeks of our orientation webinars. So, as I mentioned a little bit last week, we intentionally try to cluster the different topics and onboarding tips and tricks and things to get accomplished, get started in a week by week fashion, with the idea that as students, you can work through these tasks in a given week and have them accomplished by that Friday. But we're also here to answer your questions to help you along. So throughout today's session, please feel free to put your questions in the question and answer box, and we'll get to them certainly by the end of the presentation, if not throughout the presentation. So yes, please ask as many questions as you need to, because we are here for you to help you get ready to start your journey at Lewis and Clark. So without further ado, I am going to turn it over to our student director, Colin Bloom, to get us going.
Awesome. Thank you, Jonathan. Hi, my name is Colin Bloom. I'm the first year experience student director. And today I'm going to announce our star-studded lineup of everything well-being on campus. So from our first year experience team, we're going to have Jonathan Mans, who's the director of the first year experience, and Melanie McManamum, who's also the coordinator of the first year experience. Robin Kyler, the director of the Student Counseling Center, is also going to be here joining with us, followed with Michelle Callahan, the director of the Health Promotion and Wellness Office. We also have Amy Milne from the Student Health Center and Stephanie Tammy Mandel from the Office of Student Accessibility. And now I'm going to hand it off over to Melanie to kind of do a recap of our week 1 checklist tasks.
So again, just some reminders about last week. You should have hopefully accomplished all of these tasks here. Creating your Lewis and Clark account, setting up your email, updating emergency contact info in WebAdvisor, requesting your AP and IB scores to be sent to Lewis and Clark. Hopefully you've maybe started to learn more about academic accommodations, and you're here to hear from our experts and learn even more and get ready to take those next steps. Submitting your final transcripts. You should have received info about the first year seminar preference form, which is your words and numbers course. Oh, look at that. I have that twice. And English placement exam info. If you are an international student that speaks English as a second language, you should have received info last week. Hopefully you're getting ready to take those next steps. And this week, as Colin mentioned, this is our theme this week. We've got wellness. We are starting to look at the OSA housing accommodations process, potentially inputting your immunization dates. And we're going to take a look at what the online wellness courses are, which is something that you won't see until later this summer. But we have Michelle here to talk about it as well. So we are going to pass it. Oh, one last reminder. We've already seen some people put some questions in the Q&A throughout this presentation. If any questions come up and you want to ask them, but you're not sure when to do it, just know that you can put it in the Q&A chat at any point and we will get to everyone's questions. And with that, passing it over.
Hi, welcome to Lewis and Clark. My name is Robin Kyler, and I am the Director of Student Counseling and a psychologist here at Lewis and Clark. And I did want to mention that in putting questions in your Q&A, we want to encourage you, if you have a very specific question that might be unique to you or your student, we encourage you to reach out to one of us directly, or if you put it in the question and answer, we might respond with an encouragement and a contact for one of us. We just wanted to let you know that. Wanted to let you know the Student Counseling Center is available for all students. There is no fee for meeting with a licensed mental health professional or a graduate professional who's under the supervision of a licensed provider. And I'm going to be speaking about our services in a moment, but students will find us in Lower Odell, which is one of the residence halls on campus, and we're downstairs. And people can schedule appointments by walking in, calling us, or emailing us. And so we do encourage, for those who may be interested in an appointment, early in the semester is a good idea, before we start to get full. And we do have walk-in hours that I'll talk about in just a moment. Melanie, do you want to go ahead to the next slide? Thank you. We are licensed mental health professionals, and we offer confidential personal and mental health psychotherapy, as well as consultations and urgent appointments. And so there's a variety of services we can provide. I am going to ask Melanie to click our Meet the Staff, just so you can see what you would find there. So each of our staff members has a little blurb, so you can get a little sense of who we are. And this includes all the people who are our permanent staff. We also do have 4 graduate students in training who will be joining us, and we'll be adding them to the website, who are under the supervision of our licensed staff and who have experience providing therapy, but they're still working through their graduate requirements. So we look forward to adding some new faces to that in the fall. And go back. Oh. Thanks, Melanie. Can we? Yeah, there we go. Okay. And what we wanted to let you know is that we do have a high demand for services, and we do need to remain accessible to all students. But we also want to be responsive to individual needs. So we typically start with an initial half-hour consultation with one of our counselors, who will evaluate individual needs, get a sense of what students' needs are. Sometimes we will then invite students into ongoing counseling with us. Sometimes we find that their needs really will be better met by another support service on campus, so we help them get connected with that service. And sometimes we do help to facilitate referrals to off-campus services if we feel like that will meet their needs more fully. And so we just start with that short consultation and give a lot of options from there. Our services are entirely confidential, just the same as if you saw a licensed mental health professional off campus. Even though we're employed by the college, our records are protected by law and by our licenses. And so all information is fully confidential, with the exceptions that are present throughout the state of Oregon, which have to do with imminent risk to oneself or others, and some other restrictions that have to do always with safety of oneself or others. And so we really explain that in a lot of detail with students when they come to talk with us. We also do extend consultations for students, family and friends, faculty, staff who are concerned about a student and just kind of want to have some ideas for how to assist that student who they're concerned about. Let me go ahead. Thanks. Also wanted to let everybody know about our crisis and urgent support services, both at the Counseling Center and in general at Lewis and Clark. At the Counseling Center, weekdays when we're open, we always have same or next day urgent appointments. So students can come in between 1 and 3 any day of the week with no appointment, and we will meet with them and have a crisis support or urgent support available. Occasionally, if that's a very full day and someone's needs could wait till the next day, we might schedule them during the next day. We also do have a network called the Welfare Intervention Network on campus, which is a collection of staff and student services professionals who help to consult about students that we're concerned about. We learn about those concerns in a variety of ways. This link that will be available to you later explains more about when and also how to report if you have a concern and feel like the institution may need a coordinated response to support a student or to address a concern. And then there's always after hours help available. We do have a 24-hour crisis counseling service available, and campus safety right on campus available, along with an entire on-call network that helps to respond overnights and on weekends when the counseling center is not available. But we do have mental health consultation to that on-call system. Okay, I'm going to go to the next one. I do want to share that because of the high demand for services, some people we encourage to start looking over the summer for off-campus resources. If you know ahead of time that you really, really feel you benefit from weekly long-term therapy, or you've been using or have been really wanting to use a really specialized therapy, if you're needing psychoeducational or neuropsychological testing, perhaps to consider accommodations that will be discussed in a moment, or if you're seeking psychiatric support, we want to encourage you to consider that your needs will probably be best met for these concerns off campus. And so we encourage you to contact your insurance company to see if there are current providers in the Portland area, or if you're open to telehealth anywhere in Oregon, and contact providers pretty soon, because there might be waits for those appointments, or it might take a little while to find the best match for yourself. There's also really helpful information at the Office of Student Accessibility. It's also linked on the Counseling Center website for off-campus referrals, just some tips, as well as resources and databases to utilize for that. Personalized referral and access help can be found through our case manager, Gabby Herman, who's in the Office of Student Accessibility, and you can reach out to Gabby in August. Or after coming to campus, you can also schedule an initial consultation with the Counseling Center. We can talk with you about your individual needs or your student about their needs, and then we can help to consider options and the best resource. If on campus can meet their needs, we're happy to see them. But if we feel like they would be best met off campus, we would assist with referrals off campus. A lot of our students come every other week, not weekly, and we do have breaks. So we have breaks at winter break, at spring break. Other times, often the students are away, but sometimes students feel like they just really want a very consistent treatment, and maybe even over the summer, depending on licensing, a off-campus clinician may be available by telehealth if they're licensed in your state. And so that sometimes is a good match for people. So this is a really quick overview. We have a lot to cover, but I really do encourage you to check out our website. Please feel free to call or email us, and we are happy to give more information. And I also want to mention that on our website, there are a lot of helpful self-help resources as well. Thank you.
Thanks, Robin. Hi, everyone. My name is Michelle Callahan. I use she, her pronouns. And as it was mentioned earlier, I have the wonderful job of overseeing our Office of Health Promotion and Wellness, which is often shortened to HPW, HP and W. It's a lot of letters and a lot of acronyms as you're coming into LC. You'll learn them all quickly, I promise. I'm here 2 years. I feel like I've got a good handle on them. So I promise you'll learn them quickly. But to start, I also have the wonderful pleasure of sharing my office suite with the first year experience team. So we are both located in Fowler 110. So that is the Fowler Student Center. It's the main student center building on campus. We are going to be on the ground level. You can find us on the same floor as financial aid, the registrar, all the really fun offices that you definitely want to interact with all the time. But ours is actually really fun. We're really welcoming. Here is our contact information by phone or by email. You can reach us whenever you have the time. But when we say the Office of Health Promotion and Wellness, unlike my friends in the Student Counseling Center or the Student Health Center, some folks don't really know what that means. What does it mean? What we do at my office is we provide resources, education, and prevention programming on all different sorts of health topics that would typically concern LNC students, any college-age student. And those are some of the topics that I've listed below, sexual health, substance use prevention, interpersonal violence prevention, sleep and sleep hygiene, which is like, how well do you sleep? Which is a really big one in your college years, stress management, and so much more. And I want to acknowledge that you may have interacted with some health promotion programming that might have not been the nicest or kindest to some behaviors. And so I want to acknowledge that my office is never going to do that. We're always going to be taking the lens of really wanting you to make healthy decision making, whatever that means for you and your lifestyle. We really want that to encourage health literacy, meaning the ability to read and understand health information and how you can interpret that information to meet the needs that are in your life, and also skills development for not only your time here in college, but for any health related challenges that you might face after college as well, or your time here at LNC. And so I want to highlight something really important. Unlike my wonderful colleagues in the Student Counseling and Center and the Student Health Center, I'm not a provider. I will never be a provider. My background is in public health. You do not want me seeing what's on your toe or helping you potentially with a crisis that you're having. I will guide you wonderfully to either of those offices. So we don't diagnose, we don't treat problems. We're here to listen. We're here to help you get information or get you connected to resources that can help you in your journey. But you definitely will want to see our nurse practitioners in the health center. They are much better than I am. Next slide, Melanie. So because not a lot of people don't really know what this office is on a day-to-day, I figured it would be a good thing to highlight of common interactions that students will have with my office, right? So as Melanie mentioned earlier, it is on the NSO checklist. There are these online education modules that all incoming students have to take. And yes, I mean, you have to take them. I will follow up with you if they are not completed by the time. You will have a hold on your account for registration, meaning you won't be able to register for your classes until they get done. So please, please, please get them done when they come out. So they will be released in mid-July. You will get an email probably from Vector Solutions, or you might see my name. Either way, you'll get an email and you'll get subsequent emails probably weekly afterwards until you get both of those modules completed. There will be one that is going to be on sexual violence prevention, around consent and healthy relationships. There's another one that's going to be on substance use and substance use prevention. Those are both going to take roughly about 30 minutes to 45 minutes to get them completed. I do believe you can stop at midpoint and come back to them and save your progress. So that is nice if you want to get some of it done and then come back to it later. But they are due on the final day of, or the final weekday of NSO, which is going to be August 30th. That is going to be that Friday. So again, you'll get that email in mid-July. So be on the lookout for that or any subsequent emails after mid-July. If you don't have if you don't have an email, please feel free to reach out to the health ed email so we can get you set up and squared away. Some other ways that students might interact with our office. So at NSO, we have a wonderful program that is based in peer education, and that is our sexual health and consent facilitations. Those are a wonderful group of students who are either sophomore, junior, or seniors, and who are really interested and passionate about giving back to their community and talking to fellow students, incoming students, around the topics of sexual health and consent. So you will see that during your NSO programming, but other things that you might see from my office throughout the year, again, would be on sexual violence prevention, substance use and harm reduction, sexual health, body image, and much more. Something else that my office oversees is we have a confidential advocate program here on campus. And what confidential advocates do at their core is they are meant to support survivors or those who have been impacted by any sort of sexual misconduct or any uncomfortable situation, along with supporting friends of folks who may have been impacted by violence, and getting them connected to the support that they need, whether that is going through Title IX, whether that is setting up accommodations otherwise or supportive measures otherwise. The advocates are here to do that. There are many of us. We have a whole website. You're welcome to check it out, to where we can explain a lot more. And then finally, the last way that students typically might interact with our office is around substance use prevention, or working with students who might want to change their relationship with any substances. There's myself and my two wonderful graduate assistants are here to just talk with students in a non-judgmental, non-confrontational way, and see if someone does want to change their behavior, how we can get them set up for success. I believe that is all my slides, and I will pass it off to Amy now.
I'm muted. Sorry, start again. Amy Milne, I use she, her pronouns. I'm the Assistant Vice President for Health and Accessibility on campus. Full disclosure, I am not a medical provider. And so I'm pinching in for my two nurse practitioners who have this time off in the summer to recoup and take care of themselves. So first of all, I want to let folks know if you or your student is looking to put together a portfolio of providers for a specialist on here in Portland, our nurse practitioner, Kathleen Walker, will be back in the office at the end of July, and you can email health@lclark at that time, and she can help you with coordinating and putting together referrals and so forth. So I'm going to speak from a little bit of a administrator view, but know that any question you have, the emails being I'm in the email now. Kathleen will be in the email come the end of July. So anything specific, please feel free to email health@lclark.edu. But our clinic is open Monday through Friday from 9 to 4. Visits are free, and I've gotten a couple questions in the chat about using health insurance. So we don't bill health insurance. We can provide super bills for you to be able to seek reimbursement from your provider, but essentially anything that the provider does, you know, with their brain or in their doing a assessment is free. There's charges that are incurred for like the tests, or if we provide a vaccine or procedure, and those would be billed to your student account. Some common reasons why folks come to the Student Health Center. So oftentimes I would run a report every week. And the first reason is always upper respiratory infection. So a lot of times students who, you know, strep throat or the flu, you know, they'll come and seek some care. We do physical exams. We do annual exams, gynecological exams, travel exams. We have a lab in our health clinic, so we can draw blood, do labs, and send that out to Quest. We do have prescribers in the clinic. We help administer vaccines. This is a common question that I get from folks is allergy injections. So if you're on a maintenance dose of your allergy, so as long as you're not titrating up into what your maintenance dose is, then we can take over your protocol. What we ask is that you're on the maintenance dose. So again, a good question to come to one of our providers. And then referrals to off-campus specialists, we can help you with that. Next slide, please. Some tasks for the summer. So things that really most important for all students is that we have some things that we need you to do for us to be in compliance with the state of Oregon. Most importantly, we need you to give us your completed MMR records and to do a TB screening. So you will log into your health portal. You can do that by going to lclark.medicatconnect.com. In the upper right-hand corner, you'll see register. You'll register. So this is one of those. I know last week Melanie was going through the different ways that you have a technology presence on our campus, and some of them are single sign-on, some of them aren't. So with Medicat, you actually will create a different sign-on that you would use than the password that goes with you're signing into your Gmail, or if you're signing into WebAdvisor. So you'll go into the upper right corner, you'll register, you'll create a sign-on for yourself. And then you're going to get to next screen, please. You're going to get to the front page of the LC Health Portal. And here's where to give you some directions on how you navigate to upload your information. Next screen, please. So if you click on the immunizations tab to the left at the the forms tab, this is the forms. When you click on the forms, you're going to get to the TB screening questionnaire. When you open that up, then that will do a screening to see if you need to give us some information about doing a formal screening for TB, depending on the country that you're coming from or some traveling that you've done recently. So that will be the first thing you do. Secondly, you will upload in the immunizations. You'll click on the immunizations tab and you'll get this screen. And from there, you will upload your MMR required vaccines. Great place to look for those is getting in touch with your K-12 school. They may have record of it. Your pediatrician. If you're running into issues and you can't find your records, we have some ways. We are in the process of upgrading our immunization compliance. So in the next couple of weeks, we actually have purchased some software that will help you find your immunization, so to make it a little bit easier on you. So there's more information coming on that, but definitely if you're getting stuck and you're like, oh, I can't find my dates, send me an email at health@lclark.edu and together we'll problem solve this issue. We are, like I said at the beginning of the time, we're only open 9 to 4 during Monday through Friday. So, hopefully if you need something, it's during 9 to 4, but oftentimes what I find, it happens after hours. So in Portland, there's a lot of after hours places to get care. There's actually urgent care places very close to campus. What I like to tell every student and every parent is one of the really important tasks this summer is pull out your insurance card, take a look and start finding out, one, how do I use my insurance card? At the Office of Student Accessibility, which my colleague Stephanie is going to be on in just a minute, on our webpage, we actually have a video that talks about how to look through your insurance card, but get to know your insurance card, get to know where you are in network for urgent care, and have that really easily accessible. Because, at 11 o'clock, maybe you're out playing ultimate frisbee, glow in the dark ultimate frisbee with your pals, you roll your ankle and you're like, crap, I need to find a place to get it looked at. Having that information easily on the go is important. So we do have a nurse consultation service that we activate when the health center is closed. And that's a place that you can call, pick up the phone and get some triage, a nurse triage. Oftentimes people's insurance companies also offer that nurse hotline. So again, this is part of I'm pulling together all the things I need to know when I go to college, find out who your advice line is. Looking at the local hospitals, Oregon Health Science University is the closest hospital to our campus. It's often the one that we are usually referred to when students come to the health center and they need a specialist, but that might not be in network. You may be with Kaiser. There's a Sunnyside Kaiser Hospital, which it's about 15 to 20 minutes away from campus. So looking and seeing where am I in network? What is my local emergency room that I have access to? Lastly, we do have a service that's called Dispatch Health. And essentially, it's kind of think about the old school house call model of healthcare. So they're one that's a private company. Their number is on our webpage, but you can call them. And if it's in network with your provider, they can come to campus and offer some care. So again, pull out the insurance card, take some time this summer, understand what that means. There's some good information on the OSA website about health insurance, but have an idea of where you would go for urgent care and emergency care if it was to come up. So I'm gonna I think that's my last slide, right? Yeah, so Stephanie Timey Mandel is gonna pick up talking about the Office of Student Accessibility.
Awesome. Thanks, Amy. My name is Stephanie. My pronouns are she, her, and I work in OSA, or the Office of Student Accessibility. I'm one of the associate directors in the office. And I'm here to talk to you about who we are and what we do, and some important information for you to keep in mind as you are getting ready to come to campus. So OSA has two main roles on campus. Our first main focus is supporting students with disabilities, mainly by helping them set up and access and use and navigate accommodations. So that initial setup of accommodations, as well as helping you navigate any changes to those accommodations that need to happen, or any like challenges that come up around using your accommodations in your classes or around campus. And those accommodations could include academic as well as housing and meal plan accommodations. And then our other main focus is supporting students with accessing resources and referrals both on and off campus. So that could look like help with finding a medical or mental health provider, accessing your medical benefits or government benefits, finding other, community resources that you might qualify for, things like that. I think our office is a really great place to start if you are experiencing any barrier at Lewis and Clark and you're not sure where to go. Even if we are not the office that can directly help you with what your issue is, we usually can know or find out the right place to refer you to. So please come and see us if you're not sure where to start. Next slide. I'm including a link to the section of our website that has a list of some of our common accommodations in case you want to peruse that. I'm wondering if we could maybe drop that link in the chat. Oh, you did. Good. Thank you. This list is not exhaustive for sure. And accommodations are also highly individualized to each student based on, your documentation and your conversations with us. But this just so you can kind of get an idea of what's out there. Next slide. Here is a basic overview of our process for setting up accommodations. I'm not going to go super in depth into this because we are going to do a longer webinar later this summer that's just about OSA, I believe. So there's that. And also the other thing is that we're right in the middle of a transition to a new software system that we're going to use to do basically our entire accommodation process, but that transition is not finished yet. So I don't want to tell you what our old process is and then have it be completely different when classes start. So what I will tell you is that these three core components in this overview will remain the same. And those are to gather and submit documentation of your disabilities and your needs, meet with us to discuss your needs from your perspective. So what barriers do you experience because of your disability? What, if any, accommodations you've used in the past, what you anticipate needing in college. And then once those first two steps are done and your accommodations are approved, there will always be some follow-up paperwork to complete that you need to do in order to access your accommodations. So that could include signing a letter to accept your accommodations, filling out some paperwork to inform your professors of what your accommodations are, how to schedule exams with us if you're going to use exam accommodations, things like that. You will receive detailed instructions for your follow-up paperwork from your OSA staff member by email about what you need to do. So please make sure that you keep an eye out for those instructions and follow them. It's really important to check your email. We communicate by email a lot. And then I also want to highlight one really important deadline that we have coming up this summer, which is our housing accommodation deadline. So if you're an incoming new student and you anticipate that you may need a housing accommodation, that deadline for incoming students is July 15th. Oh, can you go back to the last slide? Sorry. Thank you. So that means that you need to have submitted your documentation to us and met with us prior to the 15th. The exceptions to this housing accommodation deadline are for assistance animals or emotional support animals and meal plan accommodations. We can process those anytime there's no deadline. But this would be if there's anything in particular about the type or the features of the housing that you live in that you anticipate needing, such as a single room, limiting to one roommate, living on the ground floor or an elevator accessible room, something like that. The other important thing to remember is that our documentation requirements are a little bit different. So we do ask for you to ask your provider, your medical or mental health provider, to fill out a specific form that asks some specific questions about your housing needs. We do have to have that piece in order to be able to approve any housing accommodation. So again, if you anticipate that you might need a housing accommodation of some sort, please engage in our process prior to the 15th of July. Okay, I can go to the next slide now. Thanks. Our general documentation guidelines are here. Again, residential accommodations require a different piece of documentation. Please reach out if you have any questions about this. I think at the end of our little set of slides, we have our contact information. So we can send you specifics and help walk you through the process. Happy to do that. So yeah, if you have any questions about, you know, documentation processes for housing or any accommodations, please reach out to us. Next slide. And I think this is Amy's slide.
So I want to reiterate a little bit. This is going to play off a little bit what Robin talked about for helpful things to do this summer. And I think that, you know, part of the thing that's lovely about the choice to come to Lewis and Clark is that when you engage with any of our offices, whether that's Michelle at Health Promotion, Robin and her team at the health at the counseling center, the team at the health center, Stephanie and her team at OSA, is you can start to develop relationships with folks. So, you know, really this individualized approach and, you know, reaching out, don't be afraid to use all the emails that we're giving you to start to make connections this summer, because what we know is creating a wellness plan prior to coming is so important to the success of you as a student here at the college. Recognizing that this, for many of you, some of you, this is not the first time you've engaged in higher ed, but for many of you, this will be the first time that you've, this is your new, so it's a new skill. This is transition, change. The way that academic feedback is given is different. The way that, you know, the team at OSA, the way that we navigate accommodations is going to feel different if that's something that you've had in your K-12. So being aware of this change and transition and being patient with yourself during this time is really important. So embrace this growth mindset. Like, you know, I like to say, like, you know, feel comfortable taking risk and know that like failure is not a negative. Failure is, you know, Stephanie and I went to lunch today and we were talking about a couple of different things. And one of the things came up about like the fact that, you know, my like trajectory through my higher ed experience and how I came to where I am now was so much about the things that I perceived as failures when they're happening, but oh my gosh, they're amazing growth opportunities. So expecting change, you know, embrace your change, expect some challenges, you know, trying not to avoid. So this summer, you know, sometimes practicing those things in the summer is a great way to kind of lean into them happening during when you get here in the fall. Being patient with yourself as you make change. If in terms of work with accommodations, if you have had psychoed testing and it has been more than 3 years, I would encourage you, if it's possible, to get new testing over the summer. What we know about the brain is it changes, and as we age, it changes and things change. And the things that will help us know the most about you as a learner will be to know how your brain works. And so if possible, we love to tell students that this is a good time to update your psychoed testing this summer. And then thinking about a wellness plan, Robin talked about this, and I'm just going to put a big exclamation point on that is, you know, talking to your natural supports, and if professional supports are part of your wellness plan right now, like what do you need? Like what feels like the right services for you? What feels like the right supports that you need? And let's start talking about getting those in place this summer. Um, you know, sometimes I'll talk to students, they're like, well, every so often, I really enjoyed having a therapist back home. I didn't use them, you know, towards the end of my high school career. I didn't really use them very often, but it was nice to be able to, at times, just grab this person. So totally good to like create, you know, reach out, make a connection to a provider in town, knowing that for the next 4 years, you'll have them in your back pocket to call. So developing your wellness plan is really important. So those are our helpful things out of OSA that we like to say. We will be doing another full hour webinar in August. And so Jonathan and his team will be pushing out that information. So you'll be able to get more into the weeds on how accommodations work. And then lastly, Stephanie mentioned the housing deadline. I'm going to kind of elaborate a little bit more. Right now, you may get on and see that, oh, there's not a lot of appointments available because there's a lot of students getting in touch with us and we're working through housing deadlines. If housing isn't a part of what you're seeking and you're looking for academic accommodations, I would ask is maybe in August, wait and make that appointment in August. We're going to be processing housing till mid-July. Stephanie's heading off to a conference. So that we'll have to kind of be spotty at the last couple weeks of July, but August 1st, we're hitting back the ground running. And so at that point, so if it's academics, I would say if you could hold off to August 1 and make appointments, that would be great. If you're looking at our schedule and you're like, Amy, I'm not seeing something that aligns, I really need to get in and see you guys, email access@lclark and we'll get you in. So not to worry, just stay in communication with us. So, all right, I think questions?
Yeah, all right. Thanks everyone for all that great information. We're open for questions. Thanks for the great questions that have been coming through the entire webinar so far. If you haven't had a chance, please feel free to enter questions as I'm speaking now. But you can go into the question and answer tab and you should be able to see all the questions that we were able to answer as we are going. Just to highlight a few things, yes, we're going to be we're posting a recording of this webinar as well as a slide deck on our website with the first year or transfer student checklist. There's helpful information in the question answered already about health insurance and billing. Question came up about placement exams. So there's a link there about the ALEX exam as well as other placement exams through our advising center. So certainly check that out if you have any questions about placement exams. A question came up about housing and living learning communities. Actually, next week, our featured guests are the wonderful people in campus living. So they'll speak a lot more about housing as well as the living learning communities. In short, there is some information I linked there. But in addition, Campus Living is hosting some of their own Q&A sessions on Fridays during the summer about their housing applications. So you can visit their website too, in the same website, if you're interested in participating in some of those. And let's see, we've got a new question that came in. So the student handbook question, I will get back to you specifics on that. And the main guiding document that we use in terms of student policies on campus is our student code of conduct. And so there's a link in our question and answer there about the student code of conduct and which guides and governs student interactions, students' responsibilities. And so there's more information there that I linked there. So feel free to put some more questions in. All right, so we got a question about the AP Spanish exam. Yeah, I would seek out, I need to look for more information, Jesse, about your question specifically about Spanish exam. But the link I put in there related to someone else's question about ALEX exams also has more information about placement exams and world languages. And so check that out. But we might be able to get, as I'm speaking, someone else on our call might be able to put some written information in there Jesse to better answer your questions, particularly about Spanish. So if I'm not able to, if someone's not able to put information in there, I'll get back to you in a few minutes with some more information on that particular item.
Jonathan, can I step in? I would say, I'll plug my dear colleague, Katie McFadden, and her team at the College Advising Center. Any information, about the ALEX exams or AP Spanish exams, getting in touch. Everyone, I believe at this point, should have gotten an email from their particular assigned advisor. But if not, you can email cac@lclark or advising@lclark. If you have questions, those specific around like what, how do I navigate this piece when it comes to my academics? Again, coming back to the lovely thing about a small college is that you're engaging with us kind of on a more personal level. So
I also would like to mention, if you took the AP exam, you can already tell College Board to have those scores sent to Lewis and Clark. And so I'd recommend doing that now. So when the scores do come out, that process is already checked off your list. And then I answered and pasted that same link that Jonathan mentioned in the chat, as well as the email to contact the advising center.
Yeah, great. These are great questions, everyone. Feel free to shoot any more questions in there in the Q&A box if you have some more.
While we wait, Colin's been very quiet on this webinar, and I just want to ask Colin, do you have like best study tip for transitioning to college life and college academics? How do you study here at Lewis and Clark?
That's a great question, Melanie. So for studying, I really like changing my environment. Kind of coming to college, I was like, wow, I get my own kind of like room to do everything in. I kind of gets like, I kind of feel stuck in my dorm room sometimes. So I like to get out and also study at the library, study at a cafe, and also kind of really make sure to like schedule times to study. Kind of like my biggest study tip for new students who come into Lewis and Clark is like put some time a day, like almost every day during the week, where you have time to actually study and do your classes. So yeah, just having a good location and having a time to study is kind of my big tip. Having coffee. Wow. I love coffee as well. That is my other third big tip. Coffee, time, and location. Those are my three things for having a good study spot.
Colin, what's your go-to cup of coffee? Or is there a go-to place for a cup of coffee? Is it on campus, or do you have a good off-campus place you like to go to?
Yeah, I'll hit you with both. I'm loving Jola Cafe right now. It's about like I think it's like 2 miles away from campus. I walk there, I bike there. It's really nice, really cute. Has a lot of good brunch items, and I order a vanilla iced latte there most mornings. Hot. If it's cold outside or if it's warm outside, I'm always taking a vanilla iced latte. So Jola Cafe is there on campus. It's always going to be the Dovecote. Really cute. All my friends, I know all their schedules. They've started to know my order too. They're like, "Oh, it's Colin. Here comes the vanilla iced latte." So those are my two spots. They're great study spots as well.
Yeah, yeah. Great. It sounds like you like to get off campus as well, stay on campus. What let me ask a follow-up, since it might be helpful for some of the folks on the call. Getting around town. So you mentioned one of the coffee houses is off campus. How easy is it to get to a place like that without a vehicle?
Yeah, that's a great question, Jonathan, because especially it's important to kind of note that freshmen are not allowed to kind of bring their cars on campus unless they have an accommodation of some sorts. And I don't have a car, and I'm going into my junior year, and there's still a lot of kind of like options to get off campus. My kind of like go-to like transportation option is going to be the Pioneer Express. Students at Lewis and Clark call it the PIO. again, we like our acronyms and shortening things. So we call it the PIO. It goes to Selwood down there. Blue Kangaroo is another coffee shop that I like to go to. If I want to like kind of go somewhere else, somewhere a little further, I also like to rent zip cars as well. And zip cars are kind of like a little like rent a car system for college students on campus. But the PIO's number one just because all my fellow peers are on it. It goes basically everywhere you need to go in Portland. It goes down to Selwood, goes down to the downtown area, passes a Fred Meyer on the way back. So I always pick up groceries when I'm coming on my way home. But that's kind of it's bikeable too. That's another way to get off campus as well. And after you kind of go on the pile, there's TriMet systems in all of Portland. And TriMet's kind of our local kind of like public transportation system. And kind of like once you get on the pile, you really could go anywhere in Portland. So I really appreciate that, having that kind of like ease accessibility on and off campus in the Portland area.
Yeah. Yeah, lots of good transportation options, as Colin was saying, the PIO Express, which is the bus that runs to from campus that we contract with, is just for Lewis and Clark faculty, staff, and students. The zip cars, which I think are like hourly rental cars essentially that are on campus. And then the TriMet system, which all students as well as faculty and staff get 75% off on all TriMet passes. And they can be purchased through our parking and transportation office. So that's a great way to get downtown or all other places around the greater Portland area. I see a question came in about the ease of using Kaiser insurance. That happens to be one of the big providers for the faculty and staff at the college. So a lot of us all use it. So I think Amy just answered that in the chat. But yes, there's plenty of Kaiser healthcare and dental facilities and pharmacies all around us.
You want me, Jonathan, I'll just say for folks who have Kaiser, really, most importantly is calling the member services and getting a visiting ID number. And so your ID number that you use in your state will be different than you use here in Oregon. So calling member services, getting that established. The closest Kaiser to us here on campus is about 20 minutes away. However, it's not really easily accessible by public transportation. So planning to use like Uber, Lyft, Zipcar will be important. So just kind of planning that as part of it.
Great, thanks, Amy. A question came in about rent or access bikes on campus. We don't have any rental bikes on campus. You certainly can have bikes on campus and park them, lock them up on campus, but I don't believe we have I can't even think one of those programs. Downtown, you see them, and other places where you can quickly rent a bike. But unfortunately, we don't have one of those on campus that I'm aware of.
Mm-hmm.
And then, Amy, do you think would you be able to answer the question about HMSA Blue Cross?
Yeah, I mean, I think I'll kind of speak to this sort of like whether it's Cigna, Blue Cross, Aetna. Really, I would say going and starting with your insurance company, calling them specifically and getting like lists of providers in the area is a great way to start. You can always cross-reference that. Like, so sometimes students will come in with their list of providers that they're through their insurance company, and then they'll come meet with Gabby, our case manager, and they'll kind of cross-reference, and Gabby can take a look at it and go, oh, well, I've been referring students over to this person and they happen to be on your insurance plan. That could be a good way to go. Things that I would think about, working through with your insurance company, what are your co-pays going to look like? So are they going to be different? The student health insurance plan that we have, your insurance has to be comparable. There's a lot of information. There is a lot of information on our webpage about the student health insurance plan. When I tell you there's a lot of information, there's a lot of words on that webpage. So take some time with it. But going through and looking at your plan and making sure it's comparable in Oregon is important. I think a lot of times we get stuck with families have insurance plans that meet the requirement if they're in, like, say, California, it's an HMO, but when they come here, it doesn't, they're not able to access the care that we require. So take some time on there, but no matter what your insurance plan, I would say, you know, starting with them. You know, Robin can talk a little bit about this too as well, but what we're seeing in referrals for mental health providers is providers in Oregon, you still have a fair amount that take health insurance. I think there's parts of the country now where a lot of mental health providers are not working with insurance companies anymore and really kind of going all private pay. We still see, you know, there's plenty of providers in network with Blue Cross, Aetna, Cigna, you know, but part of what I heard Robin say that I'm going to reiterate is getting ahead of it early is important. So starting now, reaching out, getting lists. I don't know, Robin, do you have, you know, you're in the weeds on this.
Yeah.
So
Yeah, I would echo that, and also remind folks that if you are receiving services on campus at the Student Health Center or the Student Counseling Center, you do not require insurance. I'm repeating something that we've said, but I think it bears repeating because it gets kind of lost sometimes. So the office visits at the health center, all of the visits at the counseling center are without insurance and without fee. There are some fees for labs and prescriptions a little bit at the few that they have at the health center, and a no-show fee if you just completely ghost us at the counseling center and don't let us know. But when seeking those more specialized services off campus or specific services off campus, it is really important to figure out over the summer what your insurance does for you in Portland. I can say, as a parent of a college student who went to another state to a kind of a small town that doesn't, and we have, as Jonathan mentioned, we have Kaiser, and I also have a supplemental insurance, but no providers in that small town under Kaiser, that I got my little guest number in that state, and there are some workarounds that we discovered with them. But we had to have some conversations the summer before she went there. So I do think that's really important. If you're planning to keep your family insurance, check what the coverage is, not only that you're covered in the Portland area, but also if there are providers in this area who accept that insurance for whatever it is that you may need. And then keep in mind, if you're comfortable with telehealth, that does expand out to any provider in the whole state of Oregon for those services that might be amenable to telehealth, where you might not ever really need an in-person appointment. And as Amy mentioned, case management is an excellent partner in finding that if you're getting stumped when it comes to specialized referral kind of development, more customized for health services. As Amy mentioned, Kathleen can help with that after mid-July. And for mental health, we are here over the summer, and you can ask us and we can help out if you're getting kind of stuck.
hey, Jonathan, can I mention one thing I forgot to talk about with the Student Health Center? I want to just let folks know if for some reason, you know, uploading your MMR and you're doing the TB screening, just space it, you forget it. You will get kind of stopped when you come to, you're going to come to show up for your first day to get your dorm key. And they're going to say, wait, you have to go visit the Student Health Center. And then you queue in line and it feels a little disruptive to this flow. And you're like, I want to get into my dorm room. I want to get going. So another reason why, if you can make sure you get all that stuff uploaded this summer so that when you get here, you can just start going and you're not going to be asked to come visit us right away in the Student Health Center. So thanks,
Yeah.
Jonathan.
Great. All right. Well, as Melanie will wrap us up in just a minute with the tasks coming up. I just want to remind everyone, if any other questions, I know questions will pop up, and if you're trying to remember which department do I need to talk to you about it, if nothing else, write down first year. That's one word, first year at lclark.edu. We will get you to the right person. Of course, you can rewatch this webinar and find the different addresses too, but write to first year at lclark.edu. We'll get you to the right person to get your questions answered, because we want to make sure that you have everything you need to get ready for Lewis and Clark. And with that, Melanie's going to give us a look ahead for next week.
Great. Thanks, everyone. I just want to take a quick second to thank every panelist on here. Very informative, lots of information. So we will be posting this recording as well as the slide deck on our website. And just to reiterate what everyone was saying, we strategically put this webinar as our second webinar of this series that we're doing this summer, because we want you to get started on some of this really crucial, important tasks sooner rather than later. So again, if you have any questions, we're here. We're hoping this week you're starting that OSA housing accommodations process. Remember that deadline of July 15th. Very important. You're gonna get those immunization dates inputted into that health portal. If you don't, you're gonna come to campus and you're not gonna be able to start all the fun activities of moving in and NSO, and we want you to get here and be able to jump right in. And then the online wellness courses, which you will see later this summer. But again, a very important and required task that you do have to complete in order to register for classes. So get all those things done as you see them coming through. And if you have any questions, reach out to us. We're all here to help. Like Amy mentioned, the benefits of being a small liberal arts college is, you have faces, people, and we all are here and care about you and want to support you along the way. Next week, you're going to be talking about submitting your housing application. So if you're interested, feel free to drop by into our webinar next week, same time, same place, and we'll see you all then. Thank you so much.
Bye, guys.